Jim. So I kind of just want to break down because a virtual molecular tumor board is actually, it's four things, right? So the first thing is it's a tumor board, and tumor boards have historically, are something that's been done for a long time, where you have sort of a brain trust of, surgeons and medical oncologists and radiation oncologists and pathologists, and they all come together and they discuss a case and come up with the best treatment plan for a patient. And so then with the advent of molecular testing that, really Foundation Medicine kind of pioneered, we sort of added on the molecular tumor board portion of it, which now incorporates people who are experts in reading through and interpreting these molecular tests, this comprehensive genomic profiling, next generation sequencing. And so that became the molecular tumor board portion of it, to give patients recommendations on how best to treat their cancer based on their molecular profile. And so now, really, the big innovation from Target Cancer Foundation is we put together this virtual molecular tumor board, which, these molecular tumors have really been bastions of the major academic institutions. We're talking about UC San Diego, the Harvard systems, MD Anderson, the Rutgers Cancer Institute. We've all had molecular tumor boards for quite some time. And so our patients have been able to benefit from that. But patients out in the community who are away from the major academic medical centers have not had access to molecular tumor boards. And so the treating physicians, the community oncologists, have really been tasked with interpreting these molecular tests, something that they're really not well trained for and don't have a lot of experience in. And so our virtual molecular tumor board essentially gives patients anywhere in the country, really anywhere in the world, but anywhere in the country, access to this group of physicians who are really expert in interpreting molecular tests, and hence the virtual molecular tumor board, because we all come together, we all live in different parts of the country, but we're able to come together, meet in one place at one time, and we'll go through a single molecular profile for a single patient in really great depth, and go through each of their mutations and how actionable we think they are. How likely is it that a particular mutation is a driver mutation for the cancer, making it grow, and how best to stop that growth, right? How best to inhibit those drivers. What drugs can we recommend that they try in the community? What clinical trials do we think are worth traveling for? What drugs can be brought in to the community? So this is really the sort of brain trust access to a real academic molecular tumor board. But the virtual part of it is that we make it available to anybody in the entire country, no matter where you live. And that's really the major innovation here.